I'm so pleased to be here today. I usually speak extemporaneously, but I wanted to get my thoughts down more formally to share with you. This conference was a dream of mine, and to see such a diverse group of individuals here to discuss the topic of open science is nothing short of remarkable. I want to apologize, though, that I can't stay for the entire conference. When I was invited, I had already committed to speak at my public library in my small town where I live, and although the workshop represents a major step forward in the dialogue about open science, the flyers were out and I didn't have the heart to say no to the librarians. They're a very earnest group. But tonight, when I'll be speaking with a small group of people from my town about healthcare decisions that they face, I'll be thinking about the conference, and I hope also that you will be thinking about people like that as you discuss the issues today, because this conference really is only about the people who are every day facing those decisions. Open science can have many different meanings, but for that reason, I want to focus your attention particularly on these people who face the healthcare decisions every day and depend on the availability of all the information that's relevant to the options that they are considering. So we can talk about increasing the efficiency of basic science. We can talk about sharing of control data. We can talk about how we make things better in terms of networking and sharing. But, and I think these are vitally important to the generation of knowledge that's going to help new innovation. But I would like us particularly to focus intently on the sharing of data that are relevant to decisions people are making today and that they face every day, recognizing that the missing data is impairing their ability to make informed decisions, is essentially keeping from public view information which is vital to true informed decision making and has so far hampered much of that. Our experience to date is that every time data are shared, voluntarily or not, we learn something new and important. It happens time and time again. In every case I know when data were released, especially participant-level data, the assessments of the risks and benefits of the drugs and devices changes in important ways. We learn something new. Granted that many of these episodes were in the context of concerns about products, such as Vioxx or Avandia. But still, I believe it's likely that we will learn much new information from data sharing. And in many cases, I believe that it will build in a complementary fashion to what is known. It doesn't necessarily have to be understood as a polarized situation where we're sharing data in order to oppose information that's out there. It can strengthen and help provide nuance and understanding. As Elizabeth said, a study, important study, I believe, that they published in BMJ suggested that unreleased data in many cases may strengthen evidence for a product. In fact, may as often strengthen that evidence for a product as it weakens it. In any case, what's important is that we support the idea that data are a social good and the best science takes place in the light. In that spirit, I have a special message for our industry colleagues who are here today. Your presence here is important, and I want to say very deeply appreciated. We know together that resistance to sharing data is not an issue that exclusively resides within industry. Let's just admit it. In fact, our group, led by Joe Ross, has published evidence that even the NIH-sponsored trials often, commonly, at a crazy rate are not published. That, maybe even 3 years out, a third of them are not published. Now, I will tell you, the NIH has taken this seriously. Last week they had a meeting, Francis Collins convened with the institute heads, and they're thinking very seriously about how to address this problem. So we know, let's acknowledge it. This is not an industry issue exclusively. That being said, those of you from industry know that industry has a special place in society and a special opportunity for leadership due to your organization, the way in which you own the data and control it, the kind of actions you can take. And I believe you have a meaningful motivation. The profession has less trust in your science than in NIH-sponsored studies and is less likely to act on the results of the trials you sponsor, not just the ones you conduct. The pharmaceutical and device industries no longer have the respect they once held. We know the events that contributed to these negative perceptions, and there's no reason to go into them today. But the result is a situation that does a disservice to the public, the medical profession, and the vast majority of professionals in industry who have extraordinarily high integrity and are in that industry for the right reasons. It's time to restore trust and reclaim your position. Industry is replete with those of you who I believe, have the highest ethical standards. You were drawn to work in industry because of your desire to contribute. And you know how much we depend on industry for research funding, for innovation, new ideas. It's the way we bring products to market. It is the way that we help people through that collaboration and partnership. Making meaningful actions to share data will be a big step in the direction that will help us restore and put industry back where it belongs, as a trusted source of information, as a place where people look to for help and understand as being full of individuals who are dedicated to that. There are already many heroes in industry and evidence of progress. I've heard from so many of you who have committed to this path. I want to particularly acknowledge Richard Kuntz. He isn't here yet, Chief Science Officer at Medtronic. You'll hear about this project later, but he engineered a groundbreaking decision to release fully the company's data on a product that's nearly $1 billion in annual revenue. Medtronic made clear they were seeking the truth and were willing to have others review the data, even while their own scientists were doing the same, without restriction. I spoke with John Waldstreicher last week with Jeff Nye, and she conveyed to me Janssen's commitment to share data and provide leadership. I heard news from Frank Rockhold, another hero, about remarkable changes in practice at GSK, where they are committed to releasing participant-level data and allowing the free flow of information that's going to change the game. I'm hopeful that others will follow. These individuals are not just talking about sharing control group data, as I said, or information on discontinued drugs, but sharing meaningful data relevant to drugs and devices that are on the market. They realize the studies are only possible through the generosity of people who consented to participate, and that we have an obligation to ensure the efforts of those subjects contribute as much as possible to knowledge generation. And by the way, that's going to be essential to ensure the continuing flow of individuals who are willing to participate in our trials. They also realize that in return for the privilege of selling a medical product to the public, industry bears a responsibility to ensure that all the data concerning the risks and benefits are available for everyone. I'd like to invoke a quote from Peter, I'm almost done, that he delivered in the European Parliament in Brussels at a conference on the common good. He said, "If commercial or academic success depends on withholding data that are important for rational decision-making by physicians, patients, and governments, then there's something fundamentally wrong with our priorities in healthcare." I couldn't agree more. So let's get past whether it should be done and have the conference focus on how it can be done well and responsibly, attentive to the needs and concerns of everyone who's at the table and wants to participate in this discussion and has a stake in what we do. We must minimize the possibility of abuse, and Rob's shown that there is some possibility of abuse, and maximize the probability that sharing will make research more efficient and effective, and ultimately support better decisions by patients. We need not fear data sharing. Science is self-correcting. Let the public dialogue and the scientists debate. And the public dialogue can then progress if the data are available. And let's be clear about what's needed. We need to have studies published and summary results reported in clinicaltrials.gov. But that's not enough. We need to have individual patient-level data broadly available for investigators, and not parsed out to selected investigators, but available broadly and freely. We need the protocols and case report forms. We need full sharing of the source data. If we have the will, we just need to find the way. And with the talent in the room, and with those listening on the webinar, and those who are interested, I know solutions can be found. If we're committed to the path, we can figure out how to do it. I see a day when we're all truly worthy of public's trust, and that we recognize our obligation to patients by ensuring that we are open with our science, including academics. Point at me. My own profession is not good at this. Mike has pointed this out to me. You're absolutely right. We are not good at it in academics. We need to fix this. I see a day when companies are competing on science, not marketing. Companies are competing on science, open science, not marketing. And open science and data sharing are part of their business model. I also see a day when academics get credit, not only for the papers they publish, but also for the papers that are published and the knowledge that is generated from the databases that they create and share. That credit comes to them from what others do because of what they made possible. I see a day when it's in everyone's best interest and is expected that data sharing is an essential characteristic of being a good scientist and a good citizen. When I look at the audience in the library tonight, I'll be very proud that we are taking steps to ensure that in the future their decisions will be more informed because of the free flow of information. And they will feel more confident about academics and industry as they see us working hard together to ensure data relevant to clinical decisions are rapidly shared and openly discussed. And the together is an important part to me. That is, we are finding ways to open dialogue, to have mutual respect, to work constructively, and to seek ways that we can find answers together, recognizing that from the different perspectives, there's a reason why we have the current system. And it's going to take some sensitivity, some listening to each other, to working together, but keeping our eye on what is a societal good in order to make the progress. But those people in the room tonight, when I'm talking to them, they should be impatient with us. They should be impatient to see us make real progress, get past whether to do this and solve the how, and advance forward quickly. So let's get moving. Let's show the public what we can do together. Thank you.